So oftentimes you'll hear people, if something's difficult, they're like, oh, it's like pulling teeth, or I'd rather have a root canal. People say these phrases all the time, and typically they're not connected to dentistry, so they don't really know what is entailed in these procedures. But I always laugh. I'm like, hey, wait a second, it's not that bad. Let me break down this myth.
Welcome to the Semide Dental Podcast. We're here to provide you expert insights on how dentistry can improve your quality of life and extend your health span. I'm Alex Semide, and I'm a practicing dentist, and I'll be your host, along with Jeremy Wolf. Enjoy the show.
Well, hello, everyone, and welcome back to Semide Dental Podcast. Jeremy Wolf here, and as you might notice if you're watching this, Dr. Alex is not here today. We got rid of him, didn't we?
No, we did not get rid of Dr. Alex. We love Dr. Alex.
No, never. We love Dr. Alex right here.
He is on vacation, so I'm hijacking his podcast. And as you can see, I don't have the same facial hair.
Yes, you're a lot more pretty than he is, I must say.
Well, I do tell patients that when they come in and they're like, "You're not Dr. Alex." I go, "I hope I'm prettier." So,
yeah. Okay, so topic for discussion today is something that it's funny. When I hear this, I think a lot of people out there can identify this. When I hear this, I instantly get triggered. I don't even know why, because I don't know that I've ever actually had one done. We're talking about root canals. Something about root canals just gets under everybody's skin, and it just seems like it's going to be such a painful process. Why is that? Right? Like, again, I don't think I've had one done. What am I so worried about? Let's get into this. Let's talk about what it is, why people are so scared of it, and how you make that process pretty seamless and painless at your office.
Absolutely, Jeremy. So oftentimes you'll hear people, if something's difficult, they're like, oh, it's like pulling teeth, or I'd rather have a root canal. People say these phrases all the time, and typically they're not connected to dentistry, so they don't really know what is entailed in these procedures. But I always laugh. I'm like, hey, wait a second, it's not that bad. Like, let me break down this myth. So
break it down, Dr. Tort. Let's go.
It is very, very common that people come in and they think a root canal, it's going to be the worst thing ever. I'd rather just take the tooth out.
It's worse than giving birth.
That's what I hear, but I gave birth and I disagree. So I've had root canals done and I've given birth. Trust me, the root canal is a walk in the park. But so a root canal, people, at Semide Dental, we spend a lot of time educating our patients. So the first thing, day one, we explain to a patient that the tooth has 3 layers. We have the outside protective layer, we have the middle layer, and then the inside layer, that's where we call it the pulp of the tooth. That pulp of the tooth has nerves in it and has some blood vessels. So when we have a cavity that reaches close to that inside layer of the tooth, that's when we start discussing a root canal therapy is our plan of action to save our natural tooth. So you hear root canal, you get triggered. Someone that you know in life had a poor experience with a root canal, and that's the only thing you know about root canals. So today, my goal is, let's break it down. Let's talk about how do we get recommended a root canal, and then what's the procedure like, and then break it down a little bit further. But like you said, it's an instant trigger of fear. And at Semide Dental, we're here to demystify all the fears. Last time we all got together, we talked about ghosting us. You don't want to ghost us because we don't want you to need a root canal. And then we have to, explain again and get your trust and patience. So the horror stories, there's 2 sides, right? Anything associated with pain is going to cause a horror story. Mm-hmm. The other thing is a lot of patients, they don't want to be sent around the world for their dental care. They're already scared to go to a dentist. And a lot of the times offices, they do the right thing by getting you into the right hands, sending you to a specialist. And don't get me wrong, there are times where we also will send a patient out for service if a specialist is needed. But luckily, Dr. Alex was awesome. He does implants here at the office, and I took an advanced course in endodontics. So endodontics is the specialty to do root canals. So here we do the root canals in office as well. Again, if we have to send it to the specialist, we will. But it's kind of like a one-stop shop. You can come, you can have your treatment. You don't have to meet a new provider. You can just get your treatment done in a comfort office that you're already used to. So we're really excited to extend these services to our patients and get them a little less scared of this root canal fear.
So let's dig into this a little further. I want to kind of draw a distinction between a filling and then a root canal, because I myself have had plenty of fillings. I think most people have. And if I understand correctly, filling, you basically have like missing a space in the tooth or a gap, and then plaque and things get stuck in there. And then you go in and you take some composite or material and you fill it in, hence the name filling. If I understand correctly about the root canal, this is something where I guess maybe you've had some exposure to the tooth and now it's kind of infiltrated down below the tooth into the root. And now you got to get into the root, clean it out, and do something in there. Do I have that right? Or maybe you could help.
You're pretty accurate. So a root canal therapy. So we refer to root canal therapy or endodontic therapy because a root canal sounds scary, but every tooth in your mouth has a root and a canal that it goes through. Okay. So to get a little bit more specific, we call it a root canal therapy, because the goal of a filling is that we remove infected tooth structure and replace it with a healthy replacement. Okay. A filling is good up to a certain extent. If a certain amount of tooth structure is missing, we have
baby.
We put a crown. Yes, exactly.
I know a thing or two about crowns.
Me too. Don't worry, Jeremy. I have plenty of my own as well in the back. So what happens is just like you were explaining, we have bacteria that affects the tooth. So it starts attacking that outside layer we were talking about, gets into the middle layer, and that middle layer gets direct communication into the nerve. So your body will actually try to fight off the cavity and protect itself from the inside out. And when the cavity gets close enough to the nerve, we start getting different symptoms. So with a cavity, you might say, hey, my tooth feels weird. Something's getting stuck in it. We have a physical hole. We do a filling. When the bacteria gets into the nerve itself, we have to do something about that. You have pain, you have different feelings. Sometimes patients experience nothing, but the inside nerves of the tooth, they die.
I got a question. I want to stop you right there. I'm curious. What is it about the pain associated with the tooth that is that cold pain that you get? That's just always associated with dental pain in my mind, is that like really, really cold, sharp pain. What is it about the nerves up there that cause that kind of pain as opposed to a more dull pain or something like that?
So your nerves have a level of dying. Okay. So when that middle layer of the tooth is open and exposed to the world, so it broke through that first layer, you might start having some sensitivity to colds or sweets.
Is that the dentin?
Yep, that's the dentin, Larry. Exactly.
Yeah,
Look at you. I'm going to tell Dr. Alex, he's going to be so excited that you remembered from your day one.
I'm going to get a gold star when we're done.
Maybe. Or a gold crown, your choice.
There you go.
So once that middle layer of the tooth is exposed, it can communicate to the nerve. So the outside world with the colds that you're drinking or the coffee you're drinking that's hot, it can send a signal to the nerve and the nerve responds as like, ooh, that's a trigger. Now, you had mentioned before a filling. A filling replaces tooth structure. A root canal therapy, we go in, we clean out the infected nerve, and then we fill the canal. So it's very similar to a filling in the sense of we're replacing the diseased part of the tooth, but the root canal therapy is specifically a filling of the root itself, if that makes sense. So a filling may be the solution to the tooth structure missing, but root canal therapy is the removal of disease of the canals of the tooth and filling that up. So it's a filling for the root. Now that you brought it up as that stance point, like great way to explain it to a patient, we have to clean it out and then fill it up.
Now, are you guys using for a root canal the same type of like Novocaine that you would use, the same type of numbing that you would use for just a general filling, or do you have to go deeper with it? Are there other types of medicines that you have to give in conjunction with the Novocaine, or it's just a little bit deeper?
So the same way we numb a tooth is the same way we would numb a tooth for a root canal. So the only difference is that sometimes when patients come in, you had mentioned before a dull ache pain. That is your telltale sign that a tooth is infected to an extent that is beyond a filling repairing it. So we talked about how if you have a cavity and your tooth gets that cold sensitivity, if that cold sensitivity stops as soon as you remove the cold, offender, you might not need a root canal. But if you have a dull, achy pain, it's worse at nighttime, it's a throbbing pain. Those are, hey, our nerve is affected into different types of nerves, and our nerve is dying. So you have that response of that ache pain. So if we see that, or if we take an x-ray and we see an infection, sometimes we have to do a treatment before we go ahead and open the tooth up to clean out the root canal. And that could be an antibiotic, or it could be a draining of the infection, because any infection can interfere with our medication to numb the tooth. So that's the only difference. If we have an active infection of the nerve in the root of the tooth, sometimes we have to get a patient on medication to heal that, and then our numbing medicine can work normal. But there's no special extra numbing technique that we have to do. The patients are comfortable. They come in, we explain the procedure before we even book it. We take a 3D scan of the teeth. I don't know if you knew this, but at Summit Dental, we have the CT machine. So it does a 3D view of your entire jaw, every tooth. We can see if there's an infection happening. And that's how we can help plan our treatment. So every tooth is different. No one's teeth are all the same. And sometimes a tooth is supposed to have one root that it will split in the middle, and then there's multiple roots coming off of it. With this 3D service, we are able to actually map out where the nerve goes in the tooth. So when we're cleaning it, we get everything. We don't have a half done root canal. And that's something that technology has advanced in the dental world to allow more thorough cleaning of these canals.
Aside from pain, what are some other red flags or signs that you could have an issue that you might need some work? You might need to get a root canal.
Yeah. So I will say probably 50-50 on time. Some patients present with pain, and that's how they're diagnosed to need a root canal. The other 50% is maybe they got trauma to their tooth. It could be trauma from a long time ago, and they've always noticed this one tooth is a dark gray or a different color. And when we test the tooth with our test, the nerve may not respond, which means you could have a dead nerve in your mouth. It could be not affected, but it just has no life to it, which will discolor your tooth. So some people have a discolored tooth from trauma. Some people can have a cracked tooth. So bacteria isn't getting in through a cavity per se, but it's coming in through the sides where the crack has happened. And then another thing is sometimes, because we have goals to rebuild teeth and to give people the smile that they want, teeth are very short. I know that it seems like when we're in the mouth, we're drilling away a lot, but the truth is your tooth is very, very small, and we work in very small increments. And sometimes if the nerve is too close to what we need for space, we might do what we call elective endo, which means you're getting a root canal so that we can drill further into the tooth and create our goal type of crown or smile. And it is very common that we have a mixture. So it's 50-50 times. Sometimes they have pain, sometimes they don't. Sometimes we tell a patient, hey, if it doesn't bother you that it's a different color or a shade, we might not do a root canal, but that is the recommended treatment if we have further goals to correct whatever the complaint is. So root canals are not always a scary, I have an infection, this is really bad. But if we don't have enough tooth structure, the benefit is if we take the nerve out of the tooth, we can do, it's called a post. And we literally put a pole inside the tooth and then get to rebuild the base and the form of the tooth. And then we can
put an implant to me.
Similar. So the benefits, an implant is a great option for someone who has a lot of tooth structure missing and we can't do anything about it. And we're going to lose a tooth. And it replaces one tooth with one implant. And it's an amazing option for those who can afford it. On the other side, a root canal therapy, it removes the infection or the problem, and it allows us to use what your body has already naturally made and accepted.
Yeah.
And build on top of that. So there are benefits of both, and not everyone is best fit for a root canal. You know, if a tooth has a wiggle to it, I tend to recommend to a patient, hey, doing a root canal is an option, but I don't know how long that's going to last that patient. So if that's the case, you know, we might lean toward doing an implant, because the money you're going to invest in saving this tooth, I can't guarantee how long it's going to last. There's nothing in dentistry that's forever, but we always put our best recommendation first of what's going to be best for our patient long term.
Absolutely. Dr. Tor, can you explain what it means if someone has a little, like a small little pimple on their gums? What is that?
So when we think about the tooth, we talked about cavities. If a cavity is open and the cavity is all the way into the root, the body is able to drain infection through that hole. So sometimes the pressure and everything, it has a way out. Other times, if the cavity is more internal of the tooth, patients realize that they have a pressure and a pain because the nerve infected has nowhere to go. So the inside of the tooth where the nerve is and all that, the blood vessels, they'll swell up, but the tooth
Ah,
constricts it. So you have that aching, dull throb because there's no escape to it. If that infection infects the entire nerve, it can go out the bottom of the tooth. And that's where the infection starts going into the bone area, where patients will see on their gums, right where the tooth hurts, they get that little pimple. That's
mm,
infection trying to find a way out. So when we talked about what could be different is we have to go ahead and drain that sometimes to allow that infection to have an out, and the patient has, an instant relief, but we didn't solve the problem because the bacteria is within that tooth. And until we solve that problem of the infected tissue inside the tooth, they might have that come back and forth. So they might have that pimple come and go and come and go. And whenever we have an infection in the mouth, that's going into the entire body. So if you have, or if anyone listening has pimples that pop up near teeth that bother them, please go see your dentist and get a routine exam because you may not realize how much infection is happening in teeth. And when we take x-rays, we can actually see if the bone has been damaged in the area. And a lot of people don't even know what's happening. They just know that pimple. And Jeremy, it's easy to ignore the pimple, especially when you want to ignore the dentist. So
it's so easy to ignore all this stuff until it becomes a problem. You hear that, everyone out there? Go get routine checkups, not just in dentistry, like everything, like just
yes.
prevention. An ounce of prevention is worth a pound of cure. I can't say that enough. Okay, Dr. Tart, I want you to paint the picture here for me, right? I said I've never had a root canal before. I come in to see you. You say, hey, Jeremy, guess what? You need a root canal. So we set up the appointment. I don't want to go, but I go in. I get into the room. Like, walk me through the process. How long does it take? What's the first step? What am I to expect? Because I think a lot of the trepidation that we have around this is the unknown. And if it's explained and we know exactly what we're to expect through that process, makes us feel a little bit more comfortable, does it not?
100%. So
walk us through it. Let's go.
I'll tell you, the appointment starts the appointment prior. So when we present to you, this is the treatment that's recommended. We always give the patient all the options. There's always option 1, do nothing. Option 2, move forward with the recommendation of cleaning out that root canal and doing the therapy. And then every time we do a root canal on a tooth, we have to go ahead and protect that, because once you lose the life of the tooth on the inside, it's a more brittle tooth. So you have to put a crown on top to protect it. And then, or they can choose an implant option or a bridge option. There's several options. So the appointment starts the day or the appointment prior. Once the patient commits to it, we explain in detail what to expect. So when you're coming in for the actual appointment, you have a breath of air because you know why we're doing it. You understand what happened to your tooth, and then we begin. So before you come, we take that 3D x-ray. We take a 2D x-ray. So that's your traditional, just checking where the root is. And then we do a 3D one. The 3D one helps us plan out exactly where the nerve is and how we're going to proceed forward. So that's on the doctor end. Once the patient comes in day of, we at Demystified Dental, we got the blanket, we have your personalized music. If you want the little eye mask, we have eye masks. So our assisting team, they spoil you galore. And then they bring me in, which you already are nervous to see. And then what we do, I ask if there's any other questions a patient may be concerned with. If not, we go ahead, we get them comfortable and numb. Once they're numb. Yep, comfortably numb. Tiny pinch, but a lot of the times we're complimented about, I didn't even feel a thing. So that's the best compliment you can give your dentist to anyone out there. Just tell them you didn't.
Am I also correct at Demystified Dental? I know Dr. Alex does, to make sure that you feel no pain with the needles. You're like injecting yourself with the Novocaine to is that a thing that you do there?
That we inject ourselves?
No, like you to test whether or not there's any pain, like you're
We work on each
right.
other?
Yeah, where
Yes,
did I
I
hear
will
that?
tell you that when I started back at practice with Dr. Alex, he's like, "Go ahead, give me shots." So he will do pop shot injections so that
Okay, that's
he
good.
knows we practice our comfort level. But I am a patient of Dr. Alex, so I can say personally, I don't feel a thing when he does my fillings. Yes, dentists have cavities too. So I have a really great dentist, Dr. Alex, and he told me I was good. So I'll take his word for it because I don't think there's a lying bone in that man's body. So I'll accept it. But yes, when the patient's numb, we have to put on. So at Seven Dental, we practice gold standard care, and it is gold standard that we basically block off the world from the inside of that tooth. So we have to use what's called the rubber dam. A lot of people don't know this, but it's basically a little tent that goes around the tooth, and it gives us just the review of the tooth that we're working in, so that any of the infected material is coming out of the tooth, and all the things that we're doing to the tooth are just to that one tooth. So the patient has, it's a funny little look. I'll have to send it to you, but their mouth is just open and we have a bite block so they're comfortable. And as soon as we are all set up and safe to start, we remove the infected tooth structure just like you would do with a normal filling. And then we open up.
That's the drilling part, right? Zzz, and you get in there and
We like to call it tooth removal, but yes, it's the
okay.
drilling part. And we just go deep into where we find the pulp of the tooth. So the tooth has the three layers, like the peanut M&M, the enamel, the dentin, and then the pulp. So we go through the enamel, we go through the dentin, we get to the pulp, and we start cleaning out the pulp itself. That process, we clean out the pulp of the tooth, and then we shape the inside of the tooth and remove all the dead tooth tissue that was surrounded by that bacteria. And then once we're done with that, we clean it out really well and we fill it up with something called gutta-percha. It's actually a
Gutta-percha.
funny name. No one, it's pink, it's pretty. And this gutta-percha that we put into the tooth, it seals off what we took out. So if we left it completely empty, like we talked about brittle, if you don't fill something up, can you imagine us doing a filling, taking out the cavity and not putting anything back? Not a good idea.
That would be no bueno.
Yeah. So we have to fill up the root canal. So we use something called gutta-percha. It's actually found in golf balls too. Fun fact. And it's from a tree. And then we seal off this healthy, now sterile area of your tooth. We seal it off, and then we create that buildup. That buildup's what will support that crown that we end up putting on top. And this whole procedure can be done in an hour to 2 hours. And in that 2 hours, we're hoping to do the whole crown prep too. So we try to save our patients, as long as the tooth isn't infected to a level where we have to break it into two parts, we can do your root canal and the crown prep all in one visit.
That's nice. Is a crown always required when getting a root canal, or are there scenarios where you wouldn't necessarily need a crown?
The only time that it's recommended you can get away without doing so is an anterior tooth, so the ones in the front. Sometimes if it's not cavity related, so there's not a lot of bacteria that took away tooth structure, we can actually remove the root of the tooth and do the root canal, seal it off, and get away with doing a filling. But remember, Jeremy, that inside of the tooth helps with the tooth color. So sometimes when we do a root canal on a front tooth, even though we can get away because it's less structure that we had to remove if it wasn't a cavity reason, the problem can become if the tooth changes colors, a patient's not happy. So
yeah,
I would say 80% of the time a crown is if it's a back tooth, 100% of the time. If it's a front tooth, you're looking at about 80% of the time we'll recommend a crown, but there's a 20% where you can get away without doing that and just do a filling on it.
Yeah.
Both ways are safe. Anyone's dentist, whoever is recommending the treatment, will help guide you on how much tooth structure is left for you to make that decision.
This is why it's so important in my mind. Like, I'm so happy I found you guys at Seven Dental. Like, I want to, when I go to the dentist, I obviously I like to get options. I'd like to have an explanation on what's going on, but ultimately I want to feel a level of trust with my provider, with my dentist in this case, where I could just say like, well, doc, what do you recommend? And like, that's what I will do, because you know what the best course of action is typically for patients. And I don't want to put that decision on myself to have to go out and then try to figure out what the best course of action is. And I feel like I have that with you guys, like whatever you guys tell me to do, I'm going to do that.
Jeremy, I will tell you this. There are several times where a patient says, what would you do?
Yeah.
And sometimes I shock them because I tell them, listen, if it were me, I would do this. And they're like, but that's not, it might not be the most expensive treatment. It might not be the most, long-term solution. And I said, you asked me what I would do. I'm being honest with you. So I have several fillings in my mouth from before I was a dentist where really large cavities, didn't do a root canal. Some are still holding strong from back when I got these big cavities and these big fillings. But I also have 2 root canals in my own mouth. And I also have 4 crowns. So even though people think the dentist's teeth are perfect, and I will say I did Invisalign at the office to fix my crowding. I did a lot of crowns in the back. I'm not a perfect mouth. I'm a very expensive mouth. So I understand the feelings of being in the chair, being anxious for a second. I have patients who end up taking photos of their mouth when I'm trying to do their root canal. And it's a really exciting moment for a patient to be involved and invested. So like you had mentioned, you want to trust your dentist. And once you get that fear factor out, it becomes like an interest in dentistry. Not saying that everyone who has an interest or wants to learn more will become a dentist, but you're less scared and you're like, oh, look at this cool picture that no one will care about except us. But I will say that Dr. Alex will only recommend, well, he'll give you all your options and then he'll inform you of his recommendation if you were his family member or himself. Same with me. Yep. I'm not shy. I'll tell you what, if you ask me for my opinion, I'll tell you it. I'm also realistic. What patients are able and capable of affording. I respect that. So if they share with me, I'll also give them every option because we have the front team is amazing with making things affordable so people can get the treatment that's best fit for them and not be scared of the financial scare. But I will respect what they're telling me and I will tell them, here are our options. Here's what I think would be the longest term solution for you. Because when people have a financial concern, you want to respect that and you want to make sure that they're not investing in something that will fail, which is why, Jeremy, we talk about what's the alternatives. So if saving a tooth costs you X amount of money, but the same X amount of money can get you an implant, we have those conversations. And if anyone wants to check out our blog on the summitdaydental.com website, you'll see we actually did a blog on root canals. So a lot of the same information you could find there. There's a little chart breakdown of cost, pros and cons of getting a root canal and a crown, getting an implant, getting a bridge, or getting something that comes in and out to replace the tooth if we decide to take it out. So there's a lot of options out there, and root canal therapies are amazing because, again, Jeremy, you get to save your natural tooth. And every dentist in the world wants to save natural teeth, except oral surgeons. I guess they don't.
Yes, I must say, I've been more diligent over the last several years with taking care of my teeth. I've been flossing more and brushing more, just trying to make sure that I'm setting myself up for success. I saw a video the other day. Somebody was talking about how you should always be looking out for your future self. Always have your future selves back. So often in life, we don't want to deal with something now and we just kick the can down the road until it becomes too much of a problem. And then we kick ourselves for not taking care of it earlier. It's a vicious cycle. So I'm trying to be more present and more, big on prevention. Speaking of prevention, what are some of the most common habits that eventually lead to people needing root canals?
So, the unexpected that you can't control, trauma, spontaneous infection, people can have the best hygiene and still get, an infected tooth. So I don't want people to always feel that their dental problems are you did it. And that's something we really stress at Summit Day Dental. Life happens and whatever you present to us, we're going to give you your options to get you back on track, to get you healthier. So some things are out of their control for root canals. If they get, let me tell you, once I had a kid and these headbutts, I'm like, man, I need a mouth guard just to hang out with my kid. So trauma you can't avoid, but decay you can help protect yourself. So like you had mentioned, brush 2 times a day. There are many people in this world who do not brush 2 times a day. They don't know this fact. So we start there. Let's brush our teeth 2 times a day. I always give people the goal, floss 3 days a week. If you're not doing it already, 7 days is what our goal is to get to. But if you floss 3 days a week, you're improving from 0 to 3. And routine dental cleanings, that removes so much bacteria out of your mouth, is amazing. Don't avoid the dentist. When you start getting that weird feeling, make your appointment. Go on in, get your regular checkup, or go for a limited checkup, just so that you're ahead of the game. If we are able to catch it early, it could be a solution as just a filling. If we wait, sometimes the tooth, we lose more structure, things will break. Sometimes we lose even the option to do a root canal. We have to lose a tooth. So don't ignore those early symptoms. And then if you do have a cavity, don't wait on it. Again, a filling is an option at the time we tell you. If you wait longer, it could become a crown. If you wait even longer, it could become a root canal plus a crown. If you wait even longer, we have to take a tooth out. So like you had mentioned before, it's a matter of taking early action will save you a lot of money and stress and pain down the road.
Yes. What about diet? I could only imagine that lots of sugar in your diet is going to be detrimental to the health of your teeth. Speak to that for a moment.
Jeremy, we always talk about how the mouth is a systemic connection with the rest of our body. So everything you do starts in the mouth and works its way through. I always tell patients, listen, you can eat as much sugar and candy as you'd like. I can help you protect against cavities by, our brushing techniques, our routine dental care, this and that. I can't protect you against diabetes. So anyone who knows our office, we are a Sour Patch Kid, like frequent subscriber, basically. Orange and blues are my favorite, if anyone wants to know. But I'm always constantly eating candy. That's why I have so many fillings and crowns and cavities. But flossing, if you know the proper way to floss and brush your teeth and go to your routine checkups, your diet may be okay. But things like candy, soda, coffee, a lot of these things have an acidic factor. So if you're not doing some of these preventive cares, your tooth is constantly being attacked, and the outside surface of that tooth, that enamel, that hard peanut M&M shell, it can only take so much before it weakens and breaks down. And once we're into the middle layer, that's when things spread. So Jeremy, your diet is a big factor. If you're drinking soda or something, rinse your mouth after. That's one way. Rinsing your mouth with water kind of helps get rid of some of that sugar left behind on the tooth surface. But that's why it's so important to take those preventive measures and disrupt that sugar breakdown on our tooth surface.
Yeah, I can proudly say that over the last 6 months to a year, I've significantly decreased my sugar intake. I really hardly ever drink soda now. I actually stopped drinking coffee about a week ago. The older I get and I feel my body aging, the more cognizant I am of what I'm putting inside my body to make sure that I can live a long, healthy, fruitful life. And I'm starting to feel a lot better, I must say. Sugar is the silent killer. It really is a poison to some degree.
You know what is also? Stress. Stress is a silent killer.
Indeed.
And stress paired with poor diet, your body is taking a lot of toll that isn't really
recipe for disaster. Yes. Take care of yourselves.
Yes.
We only got this one life to live. Let's make sure we live it to the fullest. Anything we missed? What would you like to leave our listeners with? Just like one little nugget, one piece of advice regarding this issue.
Don't be scared when the word or topic comes up. I will tell you that in dental school, I was trained by the most amazing endodontic faculty. Shout out to Dr. Bakiri at UFCD. She always told me she would see me again to become a specialist. And I told her absolutely not. And then here I am on a podcast talking about root canal. So I'll give her a call after this to let her know. But you have to understand that your providers doing a amazing service to help you save that natural tooth. And you might be nervous, but if you're in the right hands, you'll be able to trust that you're being treated to the standard, taking care of this infection, and you can leave your appointment feeling proud of yourself that you took care of infection in your body. And moving forward, create those goals just like you did, Jeremy, where you improve so that you don't have to be in that same situation again. We're here to help you. Someday Dental, I always say comfort doesn't cost more. I'm not sure if Dr. Alex likes that. I don't pay the bills around here. So comfort does not cost more. And I know that that's our priority here. And our team is going to ease you in every step of the way if a root canal is in your future. I have two myself. So all the rumors are not true. Good experiences do happen. And when we do our post-op call, sometimes these patients just tell us they don't feel anything. So let's hope that you have that same experience if you have to be in those chairs.
Well, I'll just be seeing you guys for cleanings from now on. I'm not going to have any more issues ever again in my mouth.
But if you do,
knock on wood. But if I do, I know where to find you guys.
Absolutely. So
right,
I think Dr. Alex is going to be jealous. We had so much fun. Should we make our own podcast, Jeremy?
Absolutely. Let's do it.
Okay. You have to come in op though. That's my preferred chairside chat.
Okay. We will make it happen.
All right.
All right. We'll leave it at that. Thanks so much, everyone, for tuning in. If you found this content useful, don't forget to like, subscribe. You know the drill. If you've had an experience, be it good, be it bad, let us know about it in the comments. We're always interested to hear about your feedback. And if we missed anything, let us know as well. We'll bring it up on the next episode. Everyone, take care. Have a lovely day. And we will catch you all next time on the next episode of the Someday Dental Podcast.
Bye.
Bye-bye.
Thanks for tuning in to this episode of the Someday Dental Podcast. We hope you enjoyed the show. Don't forget to subscribe, leave a review, and follow us on social media for the latest episodes. You can find us at Someday Dental. And if you have any questions, feel free to reach out. We're always happy to help. Until then, keep smiling and stay curious.